Hello everyone, welcome to the 11th Science Salon. My name is Sharon Wu, a science communicator at Kyushu University's Public Relations Initiative, and I will be your host today. 皆さんこんばんは。第11回サイエンスサロンへようこそ。本日の司会を務めさせていただく九州大学広報本部のサイエンスコミュニケーターの呉新林です。どうぞよろしくお願いします。九州大学では多様な知と人材を結集し、総合地で社会変革を牽引する大学を目指しています。サイエンスサロンでは総合地により社会に貢献する魅力的な研究をされている先生方をお招きし、カジュアルな雰囲気で対談を行っています。So to introduce Science Salon quickly, this is a space where we talk with researchers whose work reflects Kyushu University's Vision 2030, which is to drive social change with integrative knowledge. 本日お迎えしたのは九州大学アジア・オセアニア研究教育機構の准教授若林真美先生です。若林先生は大阪大学にて医学博士号を習得され、研究にとどまらずユニセフなどの国際機関や日本の外務省にも働いたことがあり、豊富な実務経験を持っています。現在は国際社会および地域社会における多様な健康への取り組みに注目しています。So Wakabayashi sensei, welcome to Science Salon and we are glad to have you today. Could you say hi to our audience and introduce yourself?
Thank you, Sharon. Thank you, everybody. My name is Mami Wakabayashi. I am Associate Professor in Kyushu University Institute for Asian and Oceanian Studies since October 2024. My field is global health. I am focused on the practical research, especially from the multiple access, not only for the low-income country, but also focus on the high-income country, how we can cooperate with each other. That is my field.
That's amazing. So let's start with a question that we'll ask all our researchers is, how did you find your way to global health and what you're doing exactly these days?
Thank you. That's a long story, actually, but I try to briefly introduce myself. Since I was a little elementary school, I wanted to involved in the international cooperation and to help the people in low middle income country. And I choose my major, nursing, as an undergraduate because I thought that I can directly help the people in the health field. But I was very struggle. I am not so much good at the nursing student, and the field trip in Bangladesh by myself changed my life. Because when I saw the village in the Bangladesh, there's no water, and I mean safe water, and no proper equipment, road, electricity, and also no medical facility, or even there's a small medical center, but there's no doctor, so it's very tough to live there itself. And also we need to change the entire community to improve their health condition at first. So I thought that the prevention is better than cure. So, but I don't know this field, what's called. And one professor told me that's called the public health, including the global health. So I just got the idea, word. So I want to study more about the global health. And I just went to the master and PhD in public health. And another turning point, big turning point, is during the master course, I had an opportunity to do the internship in WHO, World Health Organization. That's the special moment for me because I met a mentor. My supervisor inspired me to working in the global health as a profession. And also she encouraged me, I can do it. And even I was not so much good at the English at that time, but I tried to do my best step by step. And that's why I try to involve in this field. And now I'm as an educator and also researcher, I am involved in the global health.
That's such a nice story. You're seeing it from outside and now you're doing the practice. And also it reminds me of Nakamura Tetsu sensei, he was also alumni of Kyushu University who went to Afghanistan, who was a doctor, but also see that the water might be the very beginning that caused the question, that caused the problem. So, sorry, but can you try to summarize this in Japanese?
Thank you. そうですね、私がグローバルヘルスというフィールドに興味を持ったきっかけとなるのはバングラディッシュへの旅行というか、ボランティアの活動に参加したことが大きなきっかけとなりました。学生の頃、まずそのリアリティ、現場の状況を見るといったことから必要とされていることは何かというのを感じ、でそこから、グローバルヘルスに、もっと深く関わってみたい、その思いが、今の状況につながっていますし、でもう一つ大きなターニングポイントとしてお話しさせていただいたのはWHO という世界保健機構というところでインターンシップをさせていただいた時の出会った先生からのインスピレーションが大きいかなというふうに思っています。
Thank you. So I think you have experience in WHO and you worked on such a global issue, and also you're a member of QAOS. You have been traveling to a lot of places around the world. Besides the story in Bangladesh, is there any other moments that you are in another country involving with local community that sparked new ideas or changed your mind?
Wow, that's a lot of inspiration I got from the local people and also local community. I want to give the two examples about this, how I got the inspiration from the community. First one, I am a researcher and I do the data analysis as a social epidemiology.
Which means you can do it in office.
Yeah, any kind of do the practical work at the office, and I just use the secondary data, or sometimes I use collecting the data. But when we collect the data or analyzing the data, we need the research question, and also we need to do some of the hypotheses to analyzing the data. So the one example is I was involved in the one of the project COVAX, which is a global vaccination strategy in globally. It's not a Japanese project, it's a global project, and I work in the Ministry of Foreign Affairs. At that time, my duty is collecting the public data about the vaccination and how much the coverage of the vaccination is occur in each country.
How many countries you analyzed?
More than 190, because
Wow.
all of the country I have to analyze it. And but it is public data. It's a kind of duty work. But I realized that one of the countries, Palau, is one of the very small country in Pacific Ocean that had a very higher vaccination rate compared to the and in the beginning, very early stage. Why it is happened? And I just come up with some of the idea from my past field study experience in Palau. I have been to there, and I connected that's the hypothesis with data, and also I want to know the other countries' situation, especially small island in the different country, and I just write the paper about the from this kind of analysis, and that kind of data analysis could be the one of the example how I try to understand the background of data could be influenced to my research topic rather than just doing the task.
That's true. It's not only about numbers, but also of the living there.
Yes. Another example I want to say is in Brazil, I work in the UNICEF and as a health specialist, I involved in the childhood immunization vaccine project. And Brazil is a kind of very big country, and their vaccination strategy was quite good. Around 2000 to 2015, they had a very high vaccination coverage, and it was very good model for the middle-income country. But around 2015, their vaccination rate is getting dropping.
What's changed it?
What happened, right? And also the 2020, we know COVID-19 happened, and the COVID-19 pandemic makes worse the scenario, and almost 65% of the coverage drop. That is a catastrophe and the crisis moment. But in Brazil, 2022 and 2023, they recovered the vaccination coverage dramatically. That is an unusual situation. So I want to do some of the case study about Brazil. But the data doesn't say anything, the reason.
Exactly.
But I was in Brazil, I live in Brazil, so I had a lot of opportunity to talk with the local community people. It's not an interview, just a daily conversation. And also I have a lot of chatting with my colleagues. And I realized that this is not one factor, but the political situation in Brazil influenced a lot of the vaccination policy. And this dramatical change was occur because they have a very good strategy, so they have a resource, so they could recover very quickly, but somehow the political will be changed and declining some funding or something, that they had a very shrinking of the vaccination coverage. So like this, living in that country or the field, visiting the field, inspire me a lot.
Thank you for the examples. It's also something that in science communication we will focus on is science communication for the public's trust on science. So I think without understanding what they're really thinking about, the local people, what they're thinking about, what their need is, we cannot understand the numbers. Can you quickly summarize it in Japanese in like 30 seconds or something?
Thank you. 私がいつも大事にしているのはそのフィールドというか現場に行った時のインスピレーションとかその国のカルチャーや文化や経済そういった側面も考えながらデータを見るということを大事にしています。2つのエグザンプルを挙げさせていただきましたが、そういったエグザンプルをリサーチにつなげることができたのはその国のことをもっと国全体のことを知ろうとするアプローチから達成できたことかなというふうに考えています。
しかも研究者としてではなく本当にそこで生きている一人として向こうのローカルの人たちと接するのはもっと有益なデータといったら失礼ですけど情報がもう日常的なコミュニケーションから得られるかなって。
そうですね、日常的な会話ですごくいろんなことを学ばせていただく機会になるかなと思います。
ありがとうございます。こういう本当にブラジルとかこういうミドルインカムの国々とかでを見て国際的こういう大きい舞台で健康とか平等とかを語るときは本当に素晴らしいビジョンを持っているかなって思っていますが、実際実践しているときはそう簡単ではないですよね。例えば国でも地域でも違うコミュニティでも自分のニーズがあるし優先事項があるし、そういう中で実際に実践しているときに壁にぶつかったりすることはありましたか？そしてどうやってそれを乗り越えましたか
？In English or
either words?
So
either way you need to translate.
Okay, I will translate later in Japanese. So I want to give another example during the COVID-19 because it's one of my big topics. So I felt the big tension, strong tension between the global interest and national interest during the pandemic. As a delegate of Japan, I am a delegate of Japan because working in the Ministry of Foreign Affairs. So we want to help the global people like a low-income country who cannot afford the vaccine. So as a donor, we try to help and try to emphasize the global community is very important. But Japan, of course, government need or have to secure the vaccine in Japan.
In Japan, yes.
Yes. Otherwise, the Japanese people cannot vaccinate it and survive.
We are paying tax for them.
And so that's kind of national interest and the global context is a very conflict. But we have to make the statement as a donor and also the Japanese delegates. So very careful language selection is very necessary. And also it's very tough, but it's reviewed by the many sections, not only by me to release, but I have to make the first draft. So I feel the very tension, right?
How many people were there to create this draft?
Draft is by myself or my partner who are doing the same job, but usually the first I will draft and the debut by the many people, because this is a kind of national discussion and also global discussion.
Exactly.
It's one of the paper is debuted by the even minister or the prime minister.
Wow.
So that's a big chance. But how I try to motivate and also overcome this situation, maybe the most important for me is an open discussion with like-minded colleagues. That helps me a lot because they have their own experience or they might have faced the same problem. So when we are discussing, we can find some solution, or even not find the solution, we can reduce our own stress. Right? That's the way I try to navigate the way.
さっきいただいた素晴らしいお話、日本語に訳してもらえますか？
ありがとうございます。そうですね。私がいただいた質問の時で一番大きくなんていうのかな、緊張したというか場面としては COVID-19 の例を挙げましたけれども、そのグローバルな関心事と、自分たちの国の国益っていうものをどうやっていかにバランスを取るかっていうふうなことに対峙して、でそれを自分がステートメントという形で日本の、言葉として世界に発信するための、言ったら下書きを作らなきゃいけないっていうような場面が多々あって、そういった時にはやっぱりどうやってどういうふうに伝えるべきかっていうのをとても悩みますけれども、やっぱり他の同じセクションのいる、同僚、特に同じ思考と同じモチベーションを持った同僚とのディスカッションがその道を、解決策も探す時もありますし、次に取るべきアクションを探す時もあるし、そのアクションが見つからなくても、私たちのストレス自身が減ることもあるので、すごく役立ったかなっていうふうに思ってます。
確かになんか一人で全てを解決することはできないし、国の問題になってもグローバルの話になってももう本当に不可能だと思って、そういう国って言ったのは、国に来ている人みんなの意識のまとめみたいな感じで、より多くの人が同じディシジョンメイキングにインボルブしてくれたら、よりなんか皆さんの要求を満たすような解決策が見つかるかなって思っています。ありがとうございます。で一方そういうSo when we are talking about global health, we're back into English, we seek to ensure the equal access to care for all, regardless of their income level or regional boundaries. But today, as everyone can see that we are witnessing the change that a lot of people may state the country first sentiment, and also for the researchers, we are experiencing a significant cut of research funding.
Yeah.
That's also something troubles as well. In this changing climate, how do NGOs and also researchers navigate these challenges, and how do they continue work toward a more sustainable global health landscape for minors, for women, for children, for everyone?
That's a very serious situation right now, especially since 2025. Global health faced a shock, very big shock. A key point is shrinking of the ODA, Official Development Aid. So major donor, including the US, reducing a lot of funding. Japan maintained the funding, but the fund gap is huge because if I say that the US is a #1 donor in global health, they distribute a lot of money, and that money compared to Japan 10 times larger. Wow. So even Japan is a third or fourth founder, so it's not a small founder, but still large, right? So that's why the shifting to the US policy from the multilateral to bilateral or reducing the fund for global health has a very big impact, and that reducing the fund is weakening the project because less of the professional and also the people on the field feels the anxiety and no continuous support, so it's more getting worse scenario. So we want to change this situation, but as a researcher or educator, what we can do? That's a big question, right? Now I am conducting one of the educational project. It's called the Global Health Diplomacy Workshop at Kyushu University. And this workshop is a kind of simulation game, not a simulation game, but a simulation for the World Health Assembly, World Health Conference. And the student, I separated the student to the 4 groups, and each group is a delegate of the country, and they try to making the consensus to achieve the agreement on that one of the health topic. So that's the practical exercise makes the student try to understand the multiple aspect of the global health, because the first time I just give to each country to making a small statement which including a lot of conflict point, and also some of the national interest, emphasizing the national interest. But step by step I just give to some tips and also the group assignment to making we are not trying to making the argument. We try to cooperate with each other to achieve the consensus. And gradually the student can understand the global interest beyond the national interest. Somehow they can agree on that field, and also the importance of the evidence-based on discussion. Because especially health field, they have a lot of data. So based on the data, without emotion, we need the scientific evidence to prove what kind of standard we needed or implemented. So that kind of procedure is very important for making the awareness. I know I don't respond to your answer directly.
But that's a perfect answer to the question. I think it's not only about solving it by ourselves, but also the next generation who need to be participating in these global issues. They need to learn the techniques at least to negotiate and to reach kind of the common agreement. It's not about we're creating a conflict. We're trying to reach a peaceful and better future for everyone.
Yeah, because as an educator and researcher, we can foster the next generation as a global citizen and to build up the global understanding or public understanding. That helps to more cooperate with each other.
Also, this is going with Kyushu University's Vision 2030, using the integrative knowledge, not only in health, but also about diplomacy, about the strategies, about communication. This is such a great example.
Thank you.
Thank you, but could you please translate it into Japanese?
Yes, 特にですね、今2025年と言いましたけれども、政府開発援助というものがどの国も減らしてきているという現状があります。特にグローバルヘルスにおける大きなドナーというのがアメリカであり、そのアメリカがかなりの額を減らしてきているというので問題というか課題となってきています。今までやってきたプロジェクトが続けられないという現状があります。それに対して我々、教育者であり研究者として何ができるのかっていうのは本当に疑問に思うことはあるんですけれども、まずはエデュケーターとしてできることはその次の世代となる学生を育っていく。しかもその学生さんにそのグローバルヘルスという問題を通して自分たちでの問題解決スキルと、そしてそのグローバルヘルスという課題を通してさまざまな視点から見ていく力を養う、問題の解決する方法も問題を見ている方向もいろんな国や立場が違えばいろんな見方があるんだよっていうことをまず実感してグローバルシティズン、 になっていただくっていうのが我々のできることなんじゃないかなと思っています。
ありがとうございます。まさに九州大学のビジョン2030総合地で社会変革を牽引するっていうには合っているとは思います。こういう暗い雰囲気の中で経費が削られたりそういう中でやっぱ未来への希望は学生さんたちに新しいもう若いジェネレーションに雇っていて、かつそういう希望を作っているのはそういう教育者も含めているのは本当に大学としてそういう場を作っているのはありがたいと思っています。で続いてやっぱ教育面にもちょっと伺いたくて、先生はご自身の研究や実践で海外行くだけでなく学生さんたちも海外に連れていろいろフィールドワークやっていると聞きましたけど、そこはちょっとどうやってこういうアイディアにたどり着きましたか？その話とかいろいろ聞かせてください。
ありがとうございます。そこは私が特に言いたかったところなので、まず英語で言わせていただいて、後でトランスレートしたいかなと思いますけれども、in February this year I went to the field study in Philippines with the 4 graduate students from the different departments. Their background is civil engineering, education, the food science, and also the bioscience. So they have a lot of different diversity.
How did you get these members together?
Because from the Kyushu University, Institute of the Asian and Oceanian Studies, we have 4 clusters. And each cluster, health, natural, and also the society and industry. I asked the leader of each cluster to be selected the excellent student.
Wow.
They were recommended, but not only recommended by this leader.
But they also are eager to go there.
Yeah, they have to submit the motivation letter to me, and if the candidate was so many, I have to choose. So they write the motivation letter, and the excellent student was selected. And we went together for the 1 week the field study together, and their background is different, but I put the big theme of the field study that's called the child poverty in the children and in the Philippines. And this child poverty in the Philippines is a very serious issue. And we went to the child protection unit in the Philippine General Hospital and also children's shelter who were where the children are abused or neglected by the parents mentally or physically or sexually, so that the children were protected in the shelter. And also we went to the slum, is a kind of poverty area, to observe the real situation for the children without access of proper food and the not hygiene condition, and also the it's not safe housing, it's illegal housing. So this kind of situation observed directly, and we can smell and we can touch and we can interact with the children there. And each student will know about the their needs in the society and connect with their own discipline or research field. So that's kind of
bringing the potentials from each field together.
Yeah, the putting on each other, and during the how can I say, during the field trip, they are discussing a lot, not only for this topic, but also their background on the study field or their interest. So this kind of dialogue makes more stronger over our field trip, and it makes much fruitful.
Amazing! Wow. 日本語ですいません。
この2月にですね、私はフィリピンに、学生4名を連れてフィールドワークに行かせていただきました。その際に、学生のバックグラウンドはすごく多様なバックグラウンドを持った学生が一緒に行かせていただいたんですけれども、その学生さんたちとフィリピンにおける子どもたちの貧困という問題を一緒にリサーチしました。でその学生にとっては、特に 工学部の学生なんかはインタビューするっていうことも多分きっと初めての経験だったと思いますし、そういうフィールドビジットで子どもたちと、触れ合うという機会ももしかしたら初めての経験かもしれないです。そういった経験をさまざまな経験を、経て、でかつその学生さんたちが自分たちのフィールド、自分たちのリサーチの面からフィリピンにおける、子どもたちの貧困の、原因とは言わないですけれども、どんなことが影響しているのか、例えば教育面の学生さんは教育的な側面を深く掘り下げたいと思った学生もいますし、栄養面からの、栄養出張だとかそういった面を掘り下げて考えるっていうこともありますし、そこで得たアイデアをまたその移動中なんかねディスカッションしたりということでさまざまな学際融合的なプロジェクトになったんじゃないかなというふうに思ってます。
ありがとうございます。もう本当に先生がさっきおっしゃったように、日本に住んでいて、あるいは私の自分の出身の町に住んでいて、貧困に関する記事は読みましたけど、ビデオも見ましたけど、どうしてもその実際どんなひどい状況にあるか、どういうニーズがあるかは全くそこまでは知らないんです。実際にそこ行ってそこの匂いを感じて、実際にそこの学生さんとか子どもたちと話してからこそ本当の自分ができることがだんだん見えつつになるかなと思っています。素晴らしい研究教育プロジェクトですね。
ありがとうございます。
でそこから学生さんたちがもう先生から見て国際的な舞台に立つ際に最も身につけてほしいスキルは何でしょうか
？On the international stage, we need the idea. The silence has no impact. So I emphasize that you need to bring your idea and confess that that's the idea. Even the simple English, as long as the logic is clear, that is okay. People will want to know your idea. So if there is so many ideas, we can select from the multiple idea, or we can combine the idea and create the new idea. So that's why I think the most important thing is bring the idea and try to cooperate with people who has a different background, and beyond the discipline they can collaborate with each other. That is I really hope the student will learn.
This is amazing. Never be afraid to shout out.
Yeah.
Because your idea never knows. It should already be perfect. And I think that's a problem in many Asian countries, that we are too shy to express, but that's not how everything works.
Yeah, that's I want to say. 特に日本人、アジアの学生さんに言いたいメッセージでもあるんですけれども、自分のアイデアをぜひ他の方に共有するということを、やっていただきたいかなと思います。国際的な場で活躍していただくためには、ぜひそのアイデアっていうのを大事にしていただいて、それを他人に伝えるっていうことを怖がらないで、いただければなと思います。恥ずかしがらないで、自分のアイデアにはどのアイデアにも必ず価値があります。その時選ばれなくても、そのアイデアをもとに他の方のアイデアが生まれたり、組み合わせることによってまた新しいアイデアが出るっていうこともあるので、ぜひぜひ自分のアイデアを、発信するということをやっていただきたいなと思います。
Okay, let's move to the final part. So we talked a lot about the international backgrounds and your travel to other countries, maybe 10,000 kilometers away. But now we are coming back to Fukuoka. Actually, the first time I met Wakabayashi sensei was at an event called Dog Therapy. And this is quite a new concept in Japan. And could you tell us more about this project that you are collaborating with Professor Kikuchi sensei?
Thank you. The idea comes from the Professor Kikuchi, who went to the study abroad in Harvard University. And at the Harvard University, the dog therapy is very common. At the library, she can do the dog therapy, experience the dog therapy. And she thought that it's very great if we can do the dog therapy at in Japan. So she also dog lover and she has a dog. So she thought that it would be very good opportunity for her to do the dog therapy. And Professor Kikuchi told me that, could you reorganize the dog therapy at the Kyushu University, and we could have a chance to collaborate with that project.
Can you give us a definition of dog therapy?
That is a very difficult, or the concrete idea is we can say the dog therapy. There's three types of the animal intervention. First one is just to reduce some of the tension or the some of the feeling in that the multiple people without disease, or just normal people to be reduce the tension. That is one type of the dog therapy. And another type is one of the educational purpose to how to know about the importance of the life or something like that. And the other type is the treatment, medical treatment to some specific people who has a disease or something like that. That's kind of a different type of the dog therapy is existing, but we are focused on the more wide range of the people. So especially the student and also faculty member also important to be more improve their own well-being. Not they might don't have a health issue, but
before the deadlines.
to reduce some tension is very important. So that's way that we got that idea to more encourage the people.
本当にそういう触ったり心臓のことを聞くだけで落ち着くような感じがしますね。ドッグセラピーの説明をもう一回日本語でお願いしたいです。
ありがとうございます。ドッグセラピーをやろうと思ったきっかけは、菊池教授が、ハーバード大学に留学されてた時の経験をもとにそこでやられてたドッグセラピーが日本でできたらなというところからこのプロジェクトが始まっています。で、私たちはプロジェクトといってもまだイベントベースで2回ほどドッグセラピーをやらせていただいただけなんですけれども、ドッグセラピーっていうのはいろんな形の目的によってやり方っていうのがありますけれども、我々が目指しているドッグセラピーというのは、特に大学における、ウェルビーイングを向上させたいなという目的で学生や、教職員の皆さんがちょっとストレスを感じて、試験前にとかちょっとデッドラインが迫ってるんだけどって言った時にちょっとその緊張をほぐせるようなセッションになればなという思いでドッグセラピーを2回させていただきました。
Thank you. So we've learned that Fukuoka has been something of a hub of One Health, which is the concept of the idea that human, animal, and environment health are deeply interconnected and must be protected together. Kyushu University has a lot of ties to this movement, and can I say that this is kind of the philosophical foundation of your project?
Yes and no. I mean, we just want to do the dog therapy, and we didn't think about the One Health. But we already know the Fukuoka Prefecture promoting to the dog therapy, and our institution QAOS has a One Health module research group. So they are actively conducting the research about One Health. So I thought that somehow we can connect it on that field, and that's the one of the dog therapy is conducted by the Fukuoka Prefecture is already outsourcing by the two NGO, the NPO, Kotori and the Japan Rescue Association, and we very coincidentally one of the research member of the One Health in our institution is the husband of the NPO, NPO Dr. Kotori and the NPO. So that's where coincidentally the Professor Kikuchi was invited to the dog therapy at the high school run by these NPOs. So she thought that must be at the Kyushu University. It's fantastic, and we tried to contact with this NPO, and first dog therapy was conducted by these NPOs.
And that's how it started.
Yes.
I have a strange question. Why is a dog therapy not a cat therapy?
That is also a very good question. But our purpose, there is animal interventions. There is so many animal intervention. But as I said, the purpose of the animal intervention is important. For us, it's a kind of balancing to the well-being for the many of the people. So the dog has historically very get along with the people, and the dog has a kind of healing power or communicate with non-verbal communicate with the human. That has a long history, and they are more good at the non-verbal communication with the human.
猫派の、皆様のためにちょっと聞きたくて、なぜドッグセラピーで猫セラピーではないですかって。短くて、
はい、そうですね。犬がやっぱり歴史的にも人間との共生という意味では長い歴史がありますし、その不特定多数の人とインタラクトするという意味では犬が大変適性を持っているという点が挙げられると思います。
ありがとうございます。なんか今の世の中ではペットと一緒に出勤する職場も増えつつあります。このような体験がもしかしたら今後九州大学あるいは日本の他のところで長くもう継続的に実測する可能性がありますとお考えでしょうか。
We hope so. Especially we hope so to the conducting the dog therapy at the Kyushu University many times. But for this, I think that we need the collaboration with the Center for the Health Science and the Counseling at the Kyushu University. That is very important. So that's why the second session. We had a second session on January, and we had a collaboration of the section for the inclusion inside of the Center for the Health Science and Counseling. We could communicate with them, and step by step we are trying to internal collaboration in Kyushu University is happening. So I hope that this international collaboration can be expanded, and also we get some funding for this event and to be a more research project, because to collaborate, I mean, as a university researcher, we also need to making some of the effective science or effective evidence. So the effective evidence is needed to more scale up, or as you said, the pet can go to the some of the working place. Is it okay for everybody, or we also need to standardize the operation program, not only for the pet lover, but also people who might dislike the pet, or who might
be afraid of them.
Or have allergy.
Yes.
And this kind of also the hygiene condition is needed to consider. So that's why this kind of concept come from the One Health, not only for the human well-being, but also the animal welfare and also environmental healthy way we need to thinking about it.
I think you are coming back to the idea that we need more conversation to get a collaborative idea and to create a social better for everyone. 簡単に日本語でお願いします。
そうですね。このドッグセラピーをもちろん九州ユニバーシティ九州大学で今後もやっていけたらいいなというのが我々の願いなんですけども、それをやっていくためには我々だけじゃなくアジア・オセアニア研究機構だけじゃなく九州大学の中のコラボレーションっていうのも必要だと思いますし、そのコラボレーションを実現していくためにまずエビデンス、このドッグセラピー自体が本当に学生さんや教職員の方にとって有益であるのかっていうことを示していく必要もありますし、あとはそのドッグセラピーを負担なく運営していくためのメソッドというか、そういった標準化されたやり方っていうのも構築していく必要があると思っています。っていうのは本当に皆さんが、犬や猫が好きっていうわけではもちろんないですし、好きでも犬アレルギーだから触れないっていう人もいますし、もちろん なんていうか衛生状況、犬がどこでお手洗いをするのかっていった衛生状況っていうのも管理しないとやりっぱなしっていうことになってしまうので、そういったことをちゃんと管理するからこそ継続的で持続的で、安全安心なドッグセラピーっていうのが実施できますし、そういった中で本当に犬と、犬だけじゃなくて動物と人間との共生の在り方っていうのも考えていけるんじゃないかなと考えています。
ありがとうございます。やはり会話が必要ですよね。もう皆さんの一人の個人の趣味だけでなく、ちゃんと皆さんの要望とかを考えて動くのが長くなりますけど、最善策には導くかなとは思います。
そうですね。そういった時間をかけたプロシージャーがあってこそ実現して、どの人にとっても納得した形での実施っていうのがなるのかなっていうふうに思います。
ありがとうございます。まだまだ聞きたい話はいっぱいありますけど、そろそろ時間になりますので、最後に皆様に伝えたいメッセージがありますか
？Especially for the student and also the audience, entire audience, I want to say don't kill your curiosity. Especially I am also exploring the new idea or new topic. Like as I said, the dog therapy is quite new for me, and also I'm trying to the new research topic about the Bangladesh with the collaborating with the public portable health clinic team. That is quite new because I was joined to the Kyushu University and I founded this research team, and now I'm collaborating. So that's why I always try to seeking the seeds for the research or seeking to the new experience from the my new environment and also the coincidental encounter. That's my message. そう、私の最後のメッセージとして皆さんにお伝えしたいことは、やはり、自分の好奇心を大事にしていただきたいなと思います。私自身もまだまだその先ほど取り上げたドッグセラピーの関しても新しいトピックでリサーチにまだまだ結びつけている途上というか、まだ始まったばかりですので、そういったトピックや他にはここに九州大学に来たからこそ新しいポータブルヘルスクリニックという新しいトピックにつながることができましたし、それがなんと私が初めてグローバルヘルスに興味を持つきっかけになったバングラディッシュでやってるプロジェクトなんですね。その昔の出会いがまたやっぱり今回つながったっていうような出会いにもなりましたので、そういった新しい出会いと昔の出会い、そういったものをつなげながら、自分の興味関心をつなげていってほしいなと思います。
Thank you for sharing all these with us. I think you inspired us to think about health in a broader way. Like in one way, we need to calm down and slow down to listen to our body and our emotions and focus more on our mental health that's inside us. And on the other side, maybe in a broader way, we can look at the global situation, and especially in today's complex global landscape, that a lot of fields are need to collaborate together to kind of working together to ensure everybody has the equal access to care for spanning different societies and across boundaries. Thank you. ありがとうございます。以上、第11回サイエンスサロンでした。若林先生、ありがとうございました。
ありがとうございます。
また会いましょう。